yeah, the enthusiastic ally to trans pipeline is it's pretty real.
Yeah.
But what does it look like to have a more affirming or client-centered approach to voice care?
It's your time, it's your money, and you deserve those things to be well spent. But there isn't a destination. We're heading in that direction, and that's fine. But there isn't a point where you pass voice class. It's a difficult process, but it shouldn't be like a dread-inducing process.
Exactly.
This might be a big divide between speech pathologists and other professionals. I recommend giving those things a shot before you say, this provider isn't the one for me. It's not so much about kind of what qualifications they have as much as...
Hi, I'm Renee, and I'm a gender-affirming voice teacher. Today, I'm joined by Nora Mahon, who is a speech-language pathologist specializing in gender-affirming voice. She's also one of the creators of the Vocal Congruence Project, a really cool collection of free gender-affirming voice resources, including a provider map, which is the largest directory of its kind, allowing users to find the best vocal congruence provider for them.
Ah, damn. That sounds great.
Nora sat down with me to talk about what to look for when choosing a teacher or a speech-language pathologist to guide you in your own trans voice journey. Here's our conversation. Hi, Nora. Thank you so much for joining me.
Thank you so much for having me.
So let's start with you. Can you share with me a little bit about your background and what led you to specialize in gender-affirming voice care?
Absolutely, yeah. So I am a speech-language pathologist, and way back in my training, in my second year of undergrad, I was just shadowing a bunch of different speech-language pathologists. And one of them was a voice specialist, and one of the clients I saw with her was a transgender woman. And in that session, I just saw so much progress be made and so much joy be found and just so much identity explored in 45 minutes. And I never had seen or never did see anything like that again across the scope of speech pathology, where that impact can happen in that specific and meaningful of a way. And that kind of drove me towards voice. I was already involved in the LGBT community through advocacy, and I was the manager of my campus LGBT center, and I was like, this is great. It combines my large career goals with my personal life and my personal advocacy, and really just kind of paints this perfect picture. And as I kind of went through life and was doing these trans-serving jobs and working towards a trans-serving career, I kind of had my moment where I was like, maybe this isn't just professional. Maybe my love of serving the community is a little more personal. And so I transitioned, and then that made it all the better of not only helping the trans community, but helping my community and having a very specific lived experience to share with them that informs my work.
Wow, yeah, the enthusiastic ally to trans pipeline is pretty real.
Yeah.
So you are one of the founders of the Vocal Congruence Project, and actually through you, I learned about all the different types of fields that gender-affirming voice belongs to, and there's so many different types of providers out there. There's SLPs like you, singing teachers like me, and even peer mentors. And so how should someone go about choosing the right kind of provider for their gender-affirming voice needs?
Yeah, so it is really kind of beautiful in its diversity and how many people are stepping up to meet the needs. I think it's always driven by this desire for increased access. And for a long time historically, it was very medicalized. You had to go to a speech language pathologist, you had to go to a voice doctor and get cleared that you were healthy enough for these services. And so I'm really excited to see that expanding into multiple fields, but then that gives us the caveat of there isn't really one training pathway that says this person is qualified, this is a well-rounded and qualified provider for you. So no specific training is the magic set of skills. There's no one specific training that says this is a good provider. And so that does require us to ask of ourselves, what are we looking for? And that can be any number of things. So for someone who is I feel like I have or I might hurt my voice, then I would say, hey, let's look at that more medical route. Let's get you cleared by a voice doctor. Let's have someone who does voice disorders as well as gender-affirming voice services help you out. For someone who wants to work on their singing voice, there's probably no better person than somebody who does a lot of singing instruction in addition to their gender-affirming voice work. Or maybe you want to work with a trans person, and that is much more common in certain fields than others, or you may just have to search more narrowly within any given field. But it's not so much about kind of what qualifications they have, as much as what traits do they bring to the table that match up with you and make them a good individual choice for you.
Yeah, and I think that like as this field is starting to grow, or like starting to make relationships between the different fields that do gender affirming voice. I know that like I have met so many more speech language pathologists just in the last year than I knew like in my previous years as a gender affirming voice teacher, which is so super cool. It led me to you. But it's also nice because if I like have a student who is coming to me and I'm doing my best, but then they start to present with like something that I would classify as a pathology, I can be like, you got to go elsewhere. That's not my place. And have you seen that? Like people like going between different fields?
Absolutely, yeah. And I have referred people out to a singing specialist or something like another adjacent field that I think is best suited to support them. And so when we look at these fields, the main reason people come to a speech language pathologist, in my experience, is because their insurance covers it, maybe with some qualifications, but their insurance covers it,
Right.
and that's like the route that is most affordable for them. But for patients not kind of locked in by that financial criteria, it's if I think you'd vibe with someone else, I'm happy to like pass the baton or to share with another provider or something like that. And I think some of the most meaningful progress that I've witnessed has been multiple people giving their input for one client.
Amazing. Yeah, I think there's like a framing that it's like SLPs versus gender affirming voice teachers. And it's not. Like we do so much better when we work together, obviously.
Yeah.
So I wanted to know, what are some green flags that someone has found a supportive and competent provider? Like what will they see if they're with the right person?
It takes a bit of skill to suss out if someone is like a compatible person for you. And foundationally, we just want somebody who's like compatible at the personality level. We want you to get along. We want you to look forward to going to the voice sessions. We want someone who's going to like speak your language and be able to vibe with you. It should be like fun, ideally. And we want you to be able to have fun. So looking for someone who is just going to vibe with you. And that's not necessarily something you can find based on like an online bio. So a lot of determining if this person is right for me might take a session or two, and that's okay. Another thing with that is the like kind of their flexibility and their responsiveness. So when I say, hey, this is what I want, are they stepping up to meet that? Or they say, I don't really think so. Are they telling me what I want? Or are they stepping up to meet my needs and kind of letting me lead? I also love to see engagement with the community, especially when we have so many cisgender providers and, more so in the speech language pathology community. But I want to see someone who is putting in the work, who's volunteering in the community, who knows the stuff, to kind of give them that foundation to work competently with a trans person. Along with that, a strong network of, both in the gender affirming world of, community groups or affirming physicians or things like that. And lastly, just really knowing when to refer out, knowing when to say, I don't know that, I think this other person might be more helpful, or, I think we've hit the limits of my skills. Even a provider who's starting out, just that transparency of like, hey, you're my, third client, and I want you to know that, and I want you to know we're kind of on a journey together, and this is what that's going to look like. That openness and transparency is a really important thing to look for.
Yeah, I think so many providers don't realize that it's like not taboo to say, like, I don't know the answer to this and I will research that and come back to you, or I will refer out. I train teachers as well, and that's like their main fear. They're like, I don't want to look incompetent in front of my student. And it's like, share with them what journey you're going through. That makes us all stronger,
Absolutely. Yeah, I think it's so important for clients to understand we don't know everything. Clients teach me stuff all the time. They will say, I found this cool technique. I this is my way of thinking about it. And I always am like, let me take that. Can I please tell other clients about that? And so I think it's so two-directional and, applying to a new provider, but also to anybody. We have to feel like this relationship has an openness on both sides.
100%. And so on the other side, what would be like some red flags that someone might look out for if they're with a provider and like it's not really going well? What would those red flags be?
Yeah, I think, the inverse of all of the other ones of just like, I'm not vibing with this person. I do not have fun. I dread going to these sessions. All of those, listen to yourself. Like, you've answered your own question if you're ever at the point of like, I am not enjoying this. It's a difficult process, but it shouldn't be like a dread-inducing process. Um,
Exactly.
all of the classic ones. So if they're using outdated language, or if they're not mirroring your language that you prefer for
Hmm.
yourself and your own terminology, that's a big red flag. If you try to offer feedback or try to share a goal, and they are defensive to that. I mentioned before, they should let you lead. There's this concept of like a prescriptive approach where they say, this is how a woman sounds. This is how a man sounds. This is how we're going to get there, and not let you kind of play with that or change the dimensions within that. Because there isn't a singular sound of a woman or sound of a man or anything like that. I'll also mention like gatekeeping can be a problem. Some people say you have to have a certain amount of time, like post-social transition or on hormones. You have to be working with a mental health care provider. Sometimes those are requirements of insurance, which is terrible, but
Yeah.
that's kind of a separate issue. If the provider themselves is saying that you must be doing X, then that's pretty generally a red flag. And my last thing is just endless sessions. My philosophy is always that I teach someone to make them their own trainer. I
100%.
don't want to see them forever, and I want them to develop the skills they need to keep tweaking it, to keep playing with it, to know if it's good or if it's bad, if it's what they want or what they don't want. I'm teaching those skills, and I rarely expect to get to a final voice with someone. I expect to get them qualified to find their own final voice, if we ever do have a final voice.
Right. It's always changing as we grow and change. Isn't that so sad though? I'm the same way. Like, we're totally aligned on this, but you send them off into the world with all the skills, and then you might never see them again.
I know. I've been like, send me recordings. Send me every month. I want to
Please.
hear it. Like, please.
Yeah, exactly. It's bittersweet because I want them to spread their wings, but also I want to know. I want to be a part of the process. Okay, so you just mentioned in the red flags that a prescriptive approach, like this way to sound like a woman, can be harmful. But what does it look like to have a more affirming or client-centered approach to voice care in practice?
So I think it starts with a conversation about goals. And I like to think about goals with a client in three dimensions. So number one is the acoustic goals. I want a high pitch. I want a small resonance. I want to sound like this. And then also with that, we have congruence goals. So I want my voice to help me feel like a woman, to sound like a woman. With that is also, I want my voice to sound confident. I want my voice to sound sexy. I want my voice to sound bold. Whatever adjectives, personality, gender, age that we want to pull in to be our voice, that's under this umbrella of congruence. And then finally, we have function. Can I use this voice all day? Can it feel comfortable and not strained or anything like that? And so we have many different dimensions under our goals. And so if you go to a provider and they say, so here's how it sounds like, how to sound like a woman, and here is what you need to do, and here is, practice this 10 times a day, and you'll sound like this, and the pitch target is, 200 hertz, and they just give you the list. That is not, in my opinion, good client-centered care. I like to prioritize directions over destinations. And so if somebody does come to me and they don't have super specific goals, they just say, I want to sound like a woman, which is fine and very common.
Normal. Yeah.
I will say, we're gonna go in the direction of feminine. We're gonna do that on a bunch of different distinct traits. And all of those can go as far or as short as they need to go. And we're turning these knobs, we're finding our sweet spot in all of these things, but there isn't a destination. We're heading in that direction, and that's fine. But there isn't a point where you pass voice class. It's just a matter of when personal satisfaction is reached, when the social dynamics are, getting gendered as you would like to in public.
Mhm.
Those are the kind of outcome measures that we're more concerned with than a pitch measurement or something like that.
I'm so glad you mentioned like the distinction between personal satisfaction and social dynamics, because I feel like in class, people often will like ask me to confirm that the social dynamics are going to be what they're going to be. And, you know, like, do I sound like a woman? And I have to be like, look, I have become the worst judge of this, actually, as a result of spending all my time with trans people. Like, I have a more gender expansive view of what a voice sounds like. I don't know what John Q. Driveway at the gas station is going to say to you. And like, how do you cope with that, like, strong desire to prioritize social dynamics over personal satisfaction, or having those two things so linked?
Yeah, I do not. I agree with you. I am the worst judge of it, and I do not give that feedback. I will not say to a client, "You pass now." That is not my place, and I don't feel confident in my judgment of it. I really do believe if you walk into my office and you are a woman, you have a feminine voice. You have a woman's voice, and I'm going to perceive it as such. But I also have the knowledge that not everybody's going to.
Right.
And so I split it into those domains of like, okay, part of function is it's getting gendered correctly in public, and part of congruence is that personal satisfaction. So which one do we need to put up top? Is this a question of safety, or is this a question of you wanting to feel confident? And oftentimes that means prioritizing those social dynamics. And the real way to test that is going out and seeing what happens. And the way we can isolate voice in that question is you call a restaurant, you ask for hours, and if it's a fancy restaurant, they might say sir or ma'am or something like that.
Right.
And we just try to see what feedback can I get based on voice alone. Online video games, where it's just a username and there's no other gendered cues or anything like that. How do people perceive me? And the reality is you might not get the answers you're looking for, but that's useful information to know, okay, I'm not there yet. If my goal is to be assumed cisgender in these situations, I'm not there yet. And that's okay. It's useful information.
I love that. So when we're choosing a provider, we have to talk about cost, because insurance is a factor and cost can be a super huge barrier. So what are some of the most realistic options for someone who doesn't have insurance coverage or who can't afford to pay private lesson rates?
Absolutely. So there are, fortunately, a lot of options actually for making these services more and more affordable. So within private pay, some places will offer a self-pay discount. So if they take insurance and private pay, sometimes that private pay rate will be cheaper if you ask. Some places will do bulk discounts or sliding scale, which means that the cost is set based on your income and ability to pay. And so it's really helpful just to ask, what sort of offerings do you have to make this more affordable? And seeing, like, despite the list price on their website, what other options exist within that office or that provider. The other thing that I really love that's out there, but it comes with some caveats, is university-based clinics. So as part of speech language pathologists training, they will often have a couple semesters of graduate school in a university-based clinic. So people come to a university for speech and hearing services. They are general services across, disorders and ages and everything. And a lot of universities, especially in recent years, have started groups for gender-affirming voice. More often groups than individual services, but both are available. And in most cases, I would say those are free or heavily discounted through sliding scale. So that's a lesser known option that I recommend people look into, is the universities in their area, to see if they have a speech language pathology program and if that's a part of their offerings.
And those are like supervised by somebody who watches the clinician?
Yeah, so the caveat there is you'll be working with a master's level student, so they're in the process of obtaining their master's degree, supervised by a licensed speech pathologist.
Okay.
So their amount of experience is probably lower than most other providers, but it is a supervised experience, and especially in like a group setting, there's always a group dynamic where you learn from the other attendees who have maybe been doing this for a much longer time, who've worked with other providers. So it's more than anything, you can think about it as like that facilitated space to connect with the community with this kind of shared goal in mind. So there's a lot of good that can come of it, but it is limited in the experience of your providers.
Right.
And then the last thing I'll mention is that there is a limited number of grants available. So a couple places offer transition grants, and I've been seeing an increasing number of those be able to be applied to voice services.
Yes, me too.
Yeah, most places it'll specify like this is for surgery or something, but a lot of them are now like you can use it for your legal documents, you can use it for voice training, kind of what people consider more on the social transition side of things. And so that's been a really exciting thing. And I have a list of those that I update on my website. And I think both of the ones that I've seen lately are opening in the fall.
Amazing. Yeah, I know that Point of Pride like recently changed their transition grants to include voice services, and it didn't have to be a speech language pathologist. It can be anyone, which I think is wonderful. And a lot of people offer scholarships as well. Like I know I have a scholarship program, and a lot of other private providers have like you said, sliding scale or scholarships that you can sign up for. Lots of options. And let's not forget all the YouTube things that are out there, like free information.
Yeah, absolutely. Independent practice, I think that this might be a big divide between speech pathologists and other professionals. A lot of speech pathologists get really scared of independent practice and of different resources online. And I think there's such incredible content as long as people like kind of follow some pretty basic rules of like, if it hurts, stop.
Yes.
Then you do have a lot of freedom to explore independently using YouTube videos, self-paced classes, things like that are a much more affordable option oftentimes than like an individual training.
And you don't have to pick one or the other for people watching. Like you can do a little self-paced class and then take it to a teacher and get like some more bespoke information or you can mix and match to make your own perfect plan. I love this. So, okay, so what if somebody has found a provider, but they're not feeling good about it in the moment? What would they say to that person, and how can they evaluate if it's time to like get out of there and move on?
Yeah, I am so in favor of people breaking up with their therapists when it's time, and that across the board, speech therapist, or therapist, or anything.
Right.
It's like it's your time, it's your money, and you deserve those things to be well spent. And so I think step one is having an open dialogue and just saying, I don't know if I'm making progress. Like I don't know if I'm seeing the results. And this is a conversation I often have with clients, and sometimes it is a matter of, hey, I as the provider am seeing progress in this area, this area, this area, this area. And when I show them that, they're like, oh, okay, I understand. So it's like, it could be kind of a moment where you are not looking in the right places for progress, or even if it's not the exact sound of your voice, your comfort level with it, your knowledge of it, your willingness to try new things, all of that is progress. So that it really expands a lot broader than we might traditionally think. But there absolutely are situations where you are like, no, this isn't it. I'm wasting my time. I'm wasting my money. And that's a question to break down with your provider about why. Maybe you totally don't understand the techniques and you're just you're repeating after them, but don't understand the why behind it. Okay, let's talk about the why behind it. Maybe you feel great in the session, but you go home and you just cannot get that voice out. Okay, let's talk about the pressures of the outside world versus the therapy room. Or, maybe you don't have any opportunities to practice outside. So let's brainstorm some. And so it's kind of about figuring out where that block is, because we want to make sure that if you go and start with a new provider, you're not going to run into the same issues. We want to make sure that there's nothing solvable in the in-between. So troubleshooting down as narrowly as possible. I recommend giving those things a shot before you say, this provider isn't the one for me, unless you're noticing like major red flags. And the reality is the right provider for you is one that both clicks with you and that helps you make progress. And so at the end of the day, if one or the other or both of those is not happening for you, then we've answered the question and it's time to find an alternative approach. That doesn't necessarily mean another provider. That can be a break. That can be focusing on less in mental health counseling. That could even be phonosurgery. But trying to figure out why it's not working, trying to solve that, and then trying to create a step forward is the general process.
Yeah, and I think another green flag of a provider is that someone's going to be amenable to that conversation, because we both know that like no one provider is going to be the perfect provider for every student. Everybody gels with different people. They have different needs. They have, they want different things in their provider. And like I offer a 12-week refund policy. Like you can essentially take my whole courses, and if you come back to me and you go, you know what, that really didn't work for me, I go, please take your money and go spend it elsewhere. That's what I want. And I think all providers, well, I hope most providers want what's best for the client.
Absolutely. Yeah, I think that's an incredible thing is like my whole philosophy is like access and flexibility above everything else.
Yes.
You know, I am not tied to any client. If a client comes to me and is like, I don't know about this, like I am the first one to be like, here's the list. Here's who I think would work best for you. And I think everybody should, you know, that a green flag in a provider is someone who's going to bring that energy. Who's going to be like, all right, let's set you up for success with someone else.
It's a bit of a social pressure thing that some people put on themselves. Like, you know, you don't even want to go to a different hairdresser, like in case they find out, you know?
Absolutely. And I'm the most loyal to my hairdresser, but it's okay. We understand.
And gender-affirming voice can cost a lot more, depending on where you go, than hair. But it's both very important for transition. Okay, so I have one more question for you. If someone is watching this video and is feeling overwhelmed with where to even begin with their gender-affirming voice journey, what is one piece of advice that you would like to leave them with?
There's no one starting place that is like, this is where everybody begins. But if I had to give, you know, one thing that everybody can do, it's just play with your voice. It is, you know, push it to its extremes and its minimums and just try doing different things, just to get comfortable with your instrument, just to know, hey, this is what I'm working with, I'm feeling it out, because that might be a brand new process for you if you don't have any sort of voice background. And, you know, regardless of your intent, if that's continuing independent practice of working with a provider, or even of like pursuing the phonosurgical options, the one thing that you need to be able to do at the end of the day is have good control of your voice, and that starts somewhere. It can be as small or as big as you want it to be. It can be, you know, I'm gonna do a single glide and find my highest pitch. It could be, I'm gonna talk in a British accent all day long. But like whatever it is, just do something different than the voice that you were starting with, and just get comfortable with that concept of, hey, I'm doing something new. It's gonna feel weird, it's gonna feel goofy, it's gonna feel scary, but I'm gonna do it because that's what I gotta do.
I love that. I love that so much. So where can people find you, Nora, if they want to learn more about your services or the Vocal Congruence Project or anything else that you're doing?
Yeah, you can find all sorts of resources and information about various providers on vocalcongruence.org. You can find more about me specifically and my current work at noramahon.com.
I will link everything below for those that want to get into those links. Thank you so much for joining me today, Nora. This was a wonderful and enlightening conversation.
Thank you so much for having me. It was a pleasure talking to you.
Thank you so much to Nora for taking the time to chat with me. If you want to find links to Nora's website or the Vocal Congruence Project, you can find those in the description.
Get some.
Don't forget to like, comment, and subscribe for more trans voice education information. That's all for today. I've been Renee, and I hope this helps. If you feel comfortable and confident with one take, like, then I'm also very confident.
Yeah.
Find the best vocal congruence. So close.
That's cool.
That's a long sentence. When I wrote it, I was like, this sentence doesn't really make sense, but I think it's correct.
We're shooting videos.
That's right.